Okay, what I'd like you to do right now, would everyone please stand and remain standing as the graduates file in, please?
You feel like a candle in a hurricane, just like a picture with a broken frame, alone and helpless, like you.
My name is Buddy Harrington. I'd like to welcome y'all to the Spring Class 2014 and the Summer Class 2014's pinning ceremony. Very proud of all of you. I'd like to take a moment to recognize some people that we have in the audience. First, we have our provost of the Lake Worth campus, Dr. Vallejo. We have the Dean of Health Sciences and Public Safety, Dr. Rogers. And we have two very honored guests today. There's a nursing scholarship called the Skelly Foundation that gives a lot of money to a lot of our nursing students. And today we are honored with Patty and Mac Skelly. And I would just like any student that has received some Skelly Foundation money, please rise. The Skelly Foundation does a lot for our students. We're very, very proud to be associated with them, and we thank them very, very much. I would also like to recognize all of our adjunct faculty that are here today, down here in the front row. Would y'all please stand? And I'd like to recognize the full-time faculty that are sitting up on the podium. Would you please stand? We do have a couple of very important people that always get overlooked, and that's the staff. We have Amanda Sherrill sitting down here. We have Rhonda Bowles sitting on down here. Somewhere we have Jules Matthews. There he is, way up there. And Wendell Waltman, who is not here. He's back manning the office with Doreen. So, anyway, I'd like to welcome all of y'all to the pinning ceremony today, and hope you enjoy this ceremony. We're going to try and keep it brief, so I'll speak very shortly. I'd first like to introduce our NSA President, Scott Rowe.
Well, hello and welcome. Life is constantly changing. One chapter ends and another begins. We are now about to embark on a new journey. Soon we'll be entering the profession we have all trained so hard to be a part of. We have made it. When we started the program, this day seemed so far away. Looking back, it seems even further. It is hard to believe that I'm actually standing here with all of you right now. We have all changed so much. We have grown from students into novice but professional nurses. I can still remember that first day. We all showed up bright-eyed, bushy-tailed. We were organized. We were ready to do this. We walked into our first day of orientation, and we were excited. We had worked so hard to get to this point. We had earned our place in this program. Well, by the time we walked out of the lecture hall, there'd been a change. We all looked quite different from when we walked in. The term deer in the headlights comes to mind. We had received so much information so quickly that many of us were asking the same question: what did I get myself into? Nonetheless, we pushed on. We came back a few days later to prepare for clinical, and again, we experienced information overload. But we pushed on. We went to our first day of clinical shortly thereafter, and I don't know about everybody else, but I was scared to death. Here we were with these sick and fragile people, and they were depending on us. I had played this scenario over and over in my mind, but reality is very different. This was just one more barrier we had to overcome. We again put a smile on our faces, gloves in our hands, and we pushed on. That seemed to be the theme for nursing school. There was nothing easy about any of it, but we were persistent, we dug deep, and we pushed on. With very little sleep, lots of stress, coffee, and fast food, We overcame adversity, and here we are, the class of 2014. We were not the only ones to feel the stress. Our families were right there with us. Without them, many of us would not be standing here before you. Thank you for your sacrifice and devotion. This took a team effort, and you all helped us more than you know. During welcome night, they told us that we would be hard on everyone in our lives. They told us that we wouldn't be spending much time with you over the next 2 years. When they said that, I was thinking, it can't be that bad. Well, I was wrong. Man, was I wrong. I'm sure most of you have heard about the honey-do list. Well, I have a honey-do book. Well, in the end, I'm still married. My wife still loves me. So life is good. Honey, thank you for taking up the slack. With all the stress, there were times we had to be reminded why we were doing this. We needed to be inspired again. Our patients gave us that inspiration. They were the reason that many of us went into nursing. We wanted to help our patients get better and get home to their families while sacrificing time with ours. We wanted to decrease their suffering, comfort them, and give them hope. We wanted to make an impact on society. Nursing is one of the only professions that can fulfill those needs. In nursing, our patients are relying on us. They need our support in their most vulnerable time. Many of them are scared and alone in a very strange environment. We are their support system, their advocate, and at times, the only provider of compassion and empathy. These are the reasons many of us chose to do this. As school went on, I found another reason. That would be all my fellow students, instructors, and nurses that helped us along the way. These are some of the best, and at times, the funniest people you could ever imagine. I found out quickly that in nursing, if you don't have a sense of humor, you're not going to survive. Sorrow and pain are too abundant. A smile and some laughter are sometimes needed to make it through the day. My fellow nurses and nursing students helped me smile so many times. Whenever I felt discouraged, there was always one of you that had something helpful to say, or just listen as I vented. We not only use therapeutic communication on our patients, but we use it on our families and each other along with other skills. And wow, there were so many skills. Who knew there were 13 steps to washing your hands? If nothing else, after all of this, our families are now experts in how to log roll, make a bed, find a pulse, and the fine art of taking a blood pressure. Apparently, other students and our families make great guinea pigs. Being president, I am very fortunate. I've been given the opportunity to say thank you on behalf of all of us standing here before you. To our families, thank you for being in our corner, always supporting us. You have put up with a lot and asked for very little in return. Honey, don't worry, you're still getting a new car. To the faculty, thank you for sharing your knowledge. Your dedication to the teaching profession is admirable and cherished. By the way, the grades are already in, so you know I mean it. To my fellow students, thank you for allowing me to represent you. Thank you for always being there for me and each other. You have all grown in confidence and character. You have earned my respect and friendship. Knowing what you have all gone through to get here shows fortitude and dedication. You have all earned a place on this stage. And finally, there is one last thing I would like to say to my fellow students. I feel very fortunate to have known all of you and will miss you dearly as we part and move on to our respective careers. I'm a better person for knowing you all, and your patients should feel very fortunate to have you as their nurse. Thank you. I would like now to introduce Dr. Copeland.
Wow, that's a hard act to follow. I'm Dr. Deborah Copeland, and I have the distinct pleasure of representing the NSA chapter as the advisor. That is the Nursing Student Association, which all of our students are members of. Several of our students stepped forward and assumed leadership roles during their tenure here at Palm Beach State, and boy did they lead. They kept me running the whole time. But it's now time to recognize their dedication and commitment. And in doing so, we have a little certificate of appreciation, but we also are presenting them with a cord that they can wear with their graduation regalia tomorrow as we celebrate their graduation. So as I call your name, if you would come forward, and I will give you your certificate, and then if you'll just line up in the middle there, okay? Scott Perot. Congratulations, you did fabulous. Amanda Neal was our vice president. Come forward, Amanda. Congratulations, dear. Melissa Morton was our treasurer. Tiffany Massey was our recording secretary. Cassandra Toledo was our corresponding secretary. There, darling, congratulations. Come on, that's sweet. Rachel Lotz was our editor. Congratulations, buddy. Let's see. Caitlin Zender, co-editor. Just click this one. Stephanie Coos. Cuss. I always say your name wrong. Cuss. Stephanie Cuss. Let's try that again. Okay, there you go, dear. Co-historian Logan Clare. Congratulations. And we would also like to recognize Jennifer Periana. I'm probably killing her name. Jennifer, come forward. She was We are fortunate that we have a lot of students in varying programs. Come over, Jennifer. And she was our evening weekend liaison who kept connected to the full-time program. So we appreciate her stepping into that role, and we're going to present her with that certificate as well. So it's just my pleasure to say thank you, guys. It was a pleasure working with you, and all the best in your future endeavors.
Y'all can sit down. At this time, I'd like to ask Tony Menvetz and Robert Manhart from the Vitas Compassion Heart Award come forward.
Hello, I'm Tony Medvitz. I'm a registered nurse and a graduate of this program.
I'm Robert Manhart. Go ahead. Thank you. My name is Robert Manhart. I'm a registered nurse also, not a graduate of this particular program, but we're both employees of Vitas Innovative Hospice Care. And we're very happy and delighted to be part of your presentation and your pinning ceremony this morning. We're here to award the Compassionate Heart Award that has been initiated through the collaboration with Palm Beach State College and Vitas Innovative Hospice Care to recognize compassion and caring demonstrated by senior nursing students.
The Spring 2014 award recipient has demonstrated compassion and caring throughout the 4 semesters here at Palm Beach State as identified by her clinical instructors. This student is kind and caring while demonstrating a high level of professionalism, stated one instructor, while another stated, during the ICU rotation, this student was observed to not only be compassionate to the patient and families, but also to one of the nurses in the ICU who was experiencing a personal crisis.
The recipient has been a stay-at-home mom for the past 6 years, worked as a marine mammal trainer at SeaWorld, and plans to pursue a nursing career in medical surgical nursing or mental health nursing upon graduation. It is an honor to present the VITAS Compassionate Heart Award to
Stephanie Stone.
At this point, I'd like to recognize an outstanding student and award this student the Valerie Bickings Award for Excellence in Caring in Nursing. This is an honor, this award is in honor of Valerie Bickings, was the former faculty member who was our pediatric specialty faculty, and she taught with us for many, many years. And we honor her today by offering this award, or presenting this award. This award was selected by faculty, full-time faculty, who voted and made the choices who they thought deserved this award. And at this time, I'd like to ask Scott Hero to come forward. Now you can come back.
Oh, wow, yeah. That was a surprise. That threw me off my game here a little. Okay, now I'd like to introduce our keynote speaker. Her name is Charlene Howell. She was born in 1974 in Kingston, Jamaica. She immigrated to the United States in the year 1989, where she attended the Atlantic Community High School. Becoming a nurse had always been an aspiration of Charlene's, and through determination, dedication, hard work, and prayers, this dream was finally realized. After completing high school, Charlene was delayed in her entrance to nursing due to unforeseen challenges. However, this was solely a temporary derailment, which progressed slowly with the successful completion of a CNA course at South Tech in 1993. Charlene held a position in a local nursing home at Abbey Delray South for 5 years, after which she continued studies at the Academic for Practice Nursing and completed her LPN in 2003. She held a floating position for 7 years at West Boca Medical Center, where she provided services on med-surg, postpartum, and telemetry units. Charlene did not stop there. She later furthered her studies at Palm Beach State College, where she earned her RN in 2008. During her attendance at this institution, she was awarded the Nursing Student of the Year Award. In 2010, she applied and was transferred to the operating room, where she now currently works as a circulating nurse. With the support of her husband, Charlene's dedication to the field of nursing and continued education continues. Charlene is now attending a graduate nursing program at Walden University, where she is expected to complete her master's in leadership and management in June of 2015. Please welcome Charlene Howell.
Masters of Ceremony, Dean of Nursing Program, lecturers, clinical educators, families, friends, graduates, good morning. Firstly, I want to thank you all for the opportunity to speak to such an important graduating class from the best nursing program in Palm Beach County. Congratulations, you have done it. This is such a big deal. This is such a big deal. I sat here, this isn't a part of what I meant to say, but I sat here waiting for you guys to enter the stage, and I watched the family and friends come in, and I was watching the slideshow, and the tears started rolling because it brought back so much memories. Congratulations, guys. You did it. Never mind all those. Never mind all those care plans that we cried about so much. I don't know how many of you guys have ever heard this line, but I remember when I was a nursing student and I would meet people that have been in nursing for many years. And I would say, I'm studying to become a nurse. They would say, oh my God, can't you think about doing something else? But I tell you, a nursing program, the instructors often say to us that we needed to make sure that we get our experience on the surgical floors first, the med-surg floor first, the 1 year. The 1 year ring a bell? The 1 year experience first, to make sure that we get our feel of clinical and our comfortness in the profession. And nothing is wrong with that. As a matter of fact, I worked on the surgical floors for 7 years, and I had a great experience. But there are opportunities, other opportunities in the hospital settings too, that we can explore. There are areas such as postpartum telemetry, the emergency room, the operating room now, which I work in, pediatrics, if you're a nurse that likes to deal with children. You know, the opportunities are there to become nurses in those areas as well. And you could spend as long as you want in those areas too. Work, show your superior that you can do it, and you feel confident, and gain the promotion as even becoming the director of that floor. That too is possible. Happens all the time. You can also gain your position by further educating yourselves and becoming the CNO of that institution. It has happened. It's possible if that's what you really want to do. Keep your dreams and your goals as reality. Some nurses spend many years in the hospital, and for whatever reason, it could be an experience through a patient that they have cared for. They decide that they want to do something else outside of the hospital setting. So they now venture into the community nursing. They go out and they do home care, they do home visiting, or even school nursing. A nurse is always a nurse. But graduates, I want to share with you through my own experience in studying that nursing has continued to evolve tremendously. The cost of medicine is increasing dramatically. Large portions of funding is consumed in institutionalization costs and management of chronic conditions and end-stage diseases. For example, obesity, strokes, cardiovascular, renal diseases. As a result, preventative medicine is becoming more and central to nursing care. There is now a greater focus on community health care. This primarily involves working in the communities to prevent the development of end-stage diseases. Nurses, we have a pivotal role to drive the health care in this direction. It can be done. But what are some of the things that the future holds for us nurses? The future holds for us the community role educators. We could play a role as educating caregivers. The future also holds a role for us to influence healthcare policies for our communities. We can make representation for appropriate policy implementation. We are also leaders in driving health policies for our patients. We have institutions such as the NAA and the AORN, which I'm affiliated with, to assist our efforts in making changes. The future holds a place for us to be policymakers. We do have the opportunity to become political representatives as the leaders level of this country. Did someone say nursing is a dead-end profession? Or is nursing the premier profession for today and for the future? I came from a background of not monetary wealth, but ambition. And I knew I wanted to become a nurse. And the moment the opportunity arose for me, I took advantage of it. I went from being a certified nurse's aide, cared for the elderly, and loved it. I enjoyed making their faces pretty for breakfast in the morning, because in long-term care facilities, that's what you do. You give them showers and put the lipstick on the cheeks. Sound familiar? And make them beautiful for breakfast, lunch, and dinner. I enjoy doing that. But I wanted more. So I went back to school and I became an LPN. And when I did my med-surg rotation, I landed up there and I stayed there. And I did that for 7 years, which I loved, because I really delivered nursing care in that area. And that was good too, but I didn't stay there. I went on and I did my RN program here and sat on that same chair that you're sitting on. And I completed my RN. And I worked in the same hospital, worked in different areas, like I mentioned. I worked in the telemetry floor, I worked in postpartum, I worked in nursery, very short, flowed over there. That wasn't my home area, but I floated there. And now I've been in the operating room for 4 years. That gave me the opportunity. Growth gave me the opportunity. Ambition gave me the opportunity. Wanting to do more gave me the opportunity to do that. Now I am studying my master's because I want to make a difference now outside of the hospital setting. It is possible. You can do it. Graduates, I therefore implore you, make no apologies for becoming a nurse. Never mind what anybody says. As I told you before, someone said to me, "You sure you want to become a nurse?" Yes. Be proud of your choice. Make a difference as leaders in both your institutional or community setting. You can do it. Stand up and be counted. Shine brightly. You deserve it. You all have earned it. I am proud to be on your team. Thank you for continuing the fine legacy of this noble institution. Congratulations, graduates. Welcome to the most diverse world with many avenues to add to this noble profession. Happy Nurses Week to you all. Thank you. Congratulations again.
Thank you. Good job. On behalf of the class, I'd like to say thank you.
I get a gift.
Yes, I'd like to say thank you and present you with the gift.
Okay,
Thank you for speaking.
It's my pleasure. Thank you all for having me.
Morning. I'm Professor DeMarco. I teach in the Belgrade campus. Yeah, Belgrade campus. And I will be reading the name, and it's an honor for me to be chosen to do that. And I thank you for thinking of me to do that. Okay. First. Okay. Scott Eru. Amanda Neal. Melissa Morton. Tiffany Massey. Cassandra Toledo. Rachel Lotz. Caitlin Zender. Stephanie Cuss. Logan Clare. Brandy Raskovich.
I'm a pretty easy one.
Heather Hillman.
Melissa Towel.
Melissa Taub. Mary Ragasa. Tamika Gibson. Ruth Pierre Laponte. Renette Durasant.
Georgie Solon. Marty Georgie Solon. Marty Georgie Solon. This is Solon. S-O-L-O-N.
Georgie Solon. Marty Georgie Solon. Marie Exume. Lavarnos Nasheed. Marcus Cologne.
Andy Valerosa.
This is Ray.
Valerosa.
Andy Valarezo.
Lubomir Chinko.
Labonir Chinkov.
Stephanie Stone.
Stephanie Stone. Viviana Alvarez. Cheryl Riccardi. Cheryl Nicholson. Jerry Nicholson. Cherian Ramrup. Mabel Rodriguez. Pauline Graham. Shawnee Douglas. Luciana Ameno.
Alicia Wasilewska. Wasilewska.
Alicia Vaslevska. Stephanie Breitenbach. Jessica Clevenger. Hyatt Hostetler. Sophia Delva. Marissa Cruz. Jennifer George. Judy Barrett. Shauna Hayward. Angela King.
Yes.
Olnik Bieneme. Minerva Queen. Joanne Jordan. Bettina Herman. Margaret Silverman. Mary Alice Morera. Katina Boyton. Natalie Stark. Rebecca Pemberton.
Pretty easy one. Yeah, not too bad. Take your time.
Tim Deemer. William Eichelroth. Kristen Jenkins. Nicole Walpole. Stacy Pavia.
I did it.
Hope Marie Stevens.
Magdalene, like the Bible, Mary Magdalene Lafleur. Yes.
Mary Magdalene Lafleur. Jacinth Walker. Opal Cameron. Sabrina Clark.
Melinda Hamilton.
Melinda Hamilton. Jennifer Costantino. Felicia Hansen.
Same as you do.
Michael Duncan. Catherine Valentine Fennell. Karima Goritia. Diana Rosa Morales. Marie Noel Osel. Renee L. Dunlap.
Hands up, American. You won't get it wrong. Charlie Robinson. You got it.
Carly Robinson. Yani Diaz. Angela Milford. Jennifer Porter. Douglas Heinke. Jennifer Holt. Tina Marie Hillman. Catherine Alter Mosto. Carol Purdy. Megan Kraus. Ryan Gore. Bryce McGann.
Easy one.
Robert Shoemaker. Patricia Alexis. Allison Wright. Eunice Fernandez. Jamie Chung. Eugene Bogalter. Natasha Ramos. Courtney Leatherwood. Melissa Ferrara. Jessica Hagamon. Michael Burrell. Caitlin Castillo. Cara Johnson.
I guess Coons, yeah.
Nicholas Coons. Allison Lord.
Heath, like Heath.
Michael Heath. Kristen Parulo. Catherine Boyd. Jonathan Perlman.
Yes.
Daniel McAndrews.
Derek Shanahan. Shanahan. Yeah.
Derek Shanahan. Amy Zabrowski. Beth Harwood.
Lindsay LaFont.
Lindsay LaFelt. Alexis Reynolds.
Krista Rogers.
Krista Rogers. Allison Dix. That's it. Congratulations, graduates. All the best for the future.
Good morning, everyone. My name is Professor Barbara Prisby, and thank you. The Nightingale Pledge is a statement of the ethics and principles of the nursing profession. Although not written by Florence Nightingale, the pledge was conceived as a token of esteem for Miss Nightingale and was first recited by nursing graduates in 1893. During the Crimean War in 1854, Florence took a group of her nurses to care for wounded soldiers. The death rate was very high, mainly due to unsanitary conditions. With the improvements established by Florence and her nurses, the death rate dropped dramatically. Florence was kind and gentle with the soldiers. As she walked among them, she comforted them and gave them hope. When she made her rounds after all the medical officers had retired for the night, she could be observed moving among rows of sick and wounded soldiers, alone, with a lamp in her hand to light the way. She became known as the Lady with the Lamp. Florence Nightingale is the founder of modern nursing. She's honored as the first great nurse. She transformed nursing into a respected profession and set the standards for clean, safe hospitals. The practice of swearing in a member of a profession is very old and is still continued as a tradition in many schools of nursing. And today, we continue the tradition as we honor Florence with recital of the Nightingale Pledge. Would all nurses in the house please stand? Now, if you would please repeat after me. I solemnly pledge myself before God. And in the presence of this assembly. To pass my life in purity. And to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous. And will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standards of my profession. And will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge, in the practice of my profession. With loyalty, I will endeavor to aid the physician in his work. And devote myself to the welfare of those committed to my care. Congratulations, graduates.
Please gently blow out your candles and don't spill the wax. Okay. Well, full of smoke. Well, in closing, I just want to read a poem that's has an impact. It's written in many versions, and I'm going to read the male version of it. The author has been debated. Really can't tell you who the author is because about 3 or 4 people take claim for it, so we won't go over the author. But I want you to think about this poem and just realize that these are the patients you're going to be taking care of, and when you approach that patient, you need to look at that patient closely. It's called A Cranky Old Man. And they think I am, trust me. What do you see, nurse? What do you see? What are you thinking when you're looking at me? A cranky old man, not very wise, uncertain of habit, with faraway eyes, who dribbles his food and makes no reply when you say in a loud voice, I do wish you'd try, who seems not to notice the things that you do and forever is losing a sock or a shoe, who, resisting or not, lets you do as you will, with bathing and feeding the long day to fill. Is that what you're thinking? Is that what you see? Then open your eyes, nurse, you're not looking at me. I'll tell you who I am as I sit here so still, as I do at your bidding, as I eat at your will. I'm a small child of 10 with a father and mother, brothers and sisters who love one another. A young boy of 16 with wings on his feet, dreaming that soon now a lover he'll meet. A groom soon at 20, my heart gives a leap, remembering the vows that I promised to keep. At 25 now I have young of my own who need me to guide in a secure, happy home. A man of 30, my young now grown fast, bound to each other with ties that should last. At 40 my young sons have grown and are gone, but my woman is beside me to see I don't mourn. At 50 once more babies play around my knee, again we know children, my loved one and me. Dark days are upon me, my wife is now dead. I look at the future, I shudder with dread. For my young are all rearing young of their own, and I think of the years and the love that I've known. I'm now an old man and nature is cruel. 'Tis just to make old age look like a fool. The body it crumbles, grace and vigor depart. There is now a stone where I once had a heart. But inside this old carcass a young man still dwells, and now and again my battered heart swells. I remember the joys, I remember the pain, and I'm loving and living life over again. I think of the years, all too few gone too fast, and accept the stark fact that nothing can last. So open your eyes, nurse, open and see. Not a cranky old man, look closer, see me. Remember this poem when you meet an old person, because there is something there. I would like to thank everyone for coming today. I think one more time we should applaud our wonderful graduates. when you get them back home, you need to do one thing for me. Make sure they're reading an NCLEX book and studying every day. 100 questions a day. That's what you have them do. Make them count them off. And as soon as they can take that exam, you push them. Go take the exam. Go take the exam. Please do that for me. Okay. You can eat first. All right. What I like now, if everyone would, while you're rising, just please remain standing while we have the recessional and stay in your seats until everyone gets out, please. Thank you.